Welcome to the deep dive. Today, you've brought us some fascinating research, and we're going to unpack how people make moral decisions, particularly, within their professions.
hmm
This isn't about simple right or wrong, but really about the nuances of ethical thinking. Our goal is to explore these ideas around moral development and education based on the material you shared.
That's right. We'll be focusing on a really insightful paper called Intermediate Concepts and the Connection to Moral Education by Bebo and Tama from 1999. This work delves into different ways we can understand and, well, nurture moral reasoning.
And for you, the learner, this deep dive should provide a valuable way to understand how ethical thinking develops, especially when you're navigating the complexities of a professional field. We'll be looking at these intermediate concepts that bridge the gap between abstract moral theories and the real-world ethical dilemmas you encounter. This should give you a clearer understanding of moral education and how we even measure ethical understanding. Okay, so let's get into it. The paper starts by asking a really fundamental question. How does moral behavior actually happen?
Exactly. And to address that, it introduces Rest's four-component model of morality. This model proposes that for someone to act morally, four key things need to occur. First, there's moral sensitivity, the ability to recognize that a situation even has a moral dimension and to understand how different actions could affect everyone involved.
So it's about tuning into those ethical signals in a situation, realizing that a seemingly straightforward decision might have ethical implications.
Precisely. The second component is moral judgment. This is where an individual figures out which course of action is the most ethically justifiable. This builds on Kohlberg's work and looks at the reasoning behind the moral choices people make.
Okay, so that's the thinking part, using some kind of ethical framework to determine the right thing to do. What comes after that?
The third component is moral motivation. This involves actually prioritizing those moral values over other personal desires or concerns, things like, career advancement, relationships, or even just personal convenience.
Ah,
This is often a crucial point where ethical lapses can happen, even if someone knows what the right thing to do is.
that makes perfect sense. Knowing the right thing isn't the same as actually doing it,
Yeah.
especially when it might come at a personal cost. That's where things get tricky, right?
Absolutely. And the final component is moral character. This is the ability to actually follow through on your moral choice. It involves having the strength to overcome obstacles, resist distractions, and maintain the courage to do what you believe is right.
So it's not just about what you think or feel, but whether you have the willpower, sort of, to see it through.
Hmm.
Now, the paper emphasizes that these four components aren't a neat step-by-step process. They don't just occur in a linear fashion.
That's a really important point. The model emphasizes that these components interact in complex ways. For instance, your moral motivation might actually influence how sensitive you are to a particular moral issue.
Hmm.
And crucially, the model suggests that both your emotions affect and your reasoning cognition are involved in each of these four components. It's not a matter of separate emotional and logical processes. They're intertwined in how we experience and act morally.
Okay, so we have this four-part model for understanding how moral behavior happens. Now, how can we use this in education? How does this model help us teach ethics more effectively?
Well, the four-component model offers some really valuable guidance for developing ethics education. First, it helps us pinpoint specific areas where we can develop ways to measure ethical development.
Right.
If we want to evaluate the effectiveness of an ethics program, it makes sense to look for changes in each of these four areas. So, the model helps us identify what to assess moral sensitivity, judgment, motivation, and character.
That sounds like a much more thorough way to evaluate ethics education than just, seeing if someone can memorize a list of rules.
Exactly. Second, the model guides how we design our teaching methods. Research indicates that for ethics education to be truly effective, it needs to address multiple components, not just one.
Huh.
For example, solely focusing on improving moral reasoning might not be enough if students lack the motivation or character to act on that reasoning. The key insight for educators is that a truly effective program needs to intentionally address all four components, not just rely on improving, say, moral reasoning.
So a well-designed ethics program would aim to foster all four of these aspects in some way.
Precisely. And finally, the model helps us understand and describe existing ethics programs. For instance, programs heavily based on Kohlberg's work tend to prioritize the development of moral judgment.
Okay?
Traditional character education programs often focus on building moral character. By using this model, we can better understand what different educational approaches emphasize and where they might have gaps.
Okay, that makes sense. So the four-component model gives us a broad picture of moral functioning and how to approach moral education. But then the paper zooms in on one of these components, moral judgment, and suggests that our traditional ways of looking at it might not be entirely adequate, especially when we're talking about professionals.
That's right. The authors point out that traditional measures of moral judgment, often based on Kohlberg's stages of moral development, tend to describe very abstract, general patterns of moral growth that happen throughout a person's life.
Right, the big picture stages.
Exactly. While valuable for understanding that broad development, these might not always directly relate to the specific ethical challenges and subtleties that professionals face in their day-to-day work. This idea was proposed because researchers realized that traditional moral psychology wasn't fully capturing the nuances of ethical decision-making within, well, specialized professional domains.
So understanding these abstract stages of moral development might not directly equip a doctor or a lawyer with the specific ethical understanding they need for their profession.
Exactly, and this is where the concept of intermediate constructs comes into play. The authors propose that these intermediate concepts act as a crucial bridge connecting those abstract moral principles to the very concrete ethical considerations within a specific profession.
Interesting.
So what's really insightful here is that simply knowing general moral rules isn't enough. You need this profession-specific lens to truly navigate ethical dilemmas in your field.
Intermediate constructs.
Yeah.
That sounds like a really key idea. Can you give us an analogy maybe to help us grasp what these are?
Certainly. The paper draws a comparison to Piaget's theory of cognitive development. Think about a scientist. Reaching Piaget's highest level of formal operations, the ability for abstract thought isn't enough on its own to make someone a competent scientist.
Right.
They also need intermediate level concepts specific to their field, like understanding the principles of experimental design or the fundamental laws of physics. Similarly, in ethics, abstract moral reasoning needs to be linked to these more profession-specific understandings.
Okay, I get it. So formal moral reasoning is like having the general thinking tools, but the intermediate concepts are the specific knowledge and understanding you need to apply those tools effectively in a particular professional context.
Precisely. The paper provides some excellent examples in healthcare ethics. Concepts like professional autonomy, competence, informed consent, and confidentiality are all examples of these intermediate level concepts. These are the kinds of ethical considerations that are frequently discussed and, well, debated in healthcare settings.
And these would likely be different for other professions, right? Like law or teaching.
Absolutely. In teaching, you might encounter concepts like due process. In law, zealous advocacy is a key one, and in academia, intellectual freedom would be a central intermediate concept.
Okay.
So to put it simply, these intermediate constructs are the specific ethical principles and understandings that are central to practicing responsibly within a particular profession. These concepts provide more concrete guidance for action within those specific professional domains compared to very general principles like justice or fairness.
So below these intermediate concepts, we have something even more concrete, don't we? The actual codes of ethics that different professions have.
Yes, exactly. These codes of ethics, adopted by various professional organizations, are the most concrete level. They're essentially specific rules and guidelines designed to direct action in particular situations. However, as the paper points out, these codes often don't provide the underlying rationale or explanation for moral theory. Their effectiveness and appropriateness are often judged by how well they align with those more general intermediate concepts and principles.
And the emphasis on teaching these codes probably varies quite a bit between different professions.
It does. The paper mentions law as a profession where a significant amount of time is dedicated to learning the specific codes, as knowledge of these codes is often tested in licensing exams.
Right.
In contrast, health professions might place less direct emphasis on memorizing the code itself, focusing more on the underlying intermediate concepts.
So when we're talking about teaching professional ethics, we're really looking at these three levels of abstraction. The really broad justification of moral systems, then these profession-specific intermediate concepts, and finally the very specific codes of ethics.
That's the framework the paper proposes. And when it comes to understanding adult moral judgment development at that most abstract level, the authors also note a shift in thinking. Instead of Kohlberg's 6 stages, they suggest that research with adults really supports 3 basic schemas that represent a move from more conventional to post-conventional thinking.
Okay, a simpler model for adults.
Yeah. They also point out that we don't necessarily know if these intermediate concepts themselves follow a strict developmental sequence, and knowledge of professional codes probably doesn't either. So having this framework for understanding moral behavior, the natural next question is, how can we use this to actually teach ethics more effectively?
Okay, so we have this idea of intermediate concepts being really important.
Hmm.
Now, the paper goes on to describe some research that specifically looked at these concepts in the field of dentistry.
Yes. They developed what they called the Intermediate Concept Measure, or ICM, within an existing dental ethics curriculum. Their approach to making sure this measure was valid was quite thorough. They focused on making sure the scenarios reflected real-world practice for dentists,
Right, realistic cases.
getting agreement among ethics experts on what constituted better and worse actions and justifications in those scenarios, and then seeing if the measure could differentiate between groups with different levels of dental ethics understanding.
And how did they make sure these scenarios were realistic? Did they just make them up?
No, they worked directly with practicing dentists to write the case studies, and then they had other dentists review them to ensure they were authentic. They also made a point of using clear, non-technical language or providing footnotes to explain any necessary dental procedures.
Ah, good.
The aim was to assess ethical reasoning related to intermediate concepts, not just technical dental knowledge.
That makes sense. You want to be testing their ethical understanding, not just their clinical skills or jargon. The paper gives an example case with the John Block situation. Can you walk us through that?
Certainly. So John Block, who's a patient of record, asks his dentist, Dr. Meyer, to extract a healthy back tooth. Dr. Meyer's records show that he had already performed a root canal and put a crown on that tooth a couple of years prior.
Okay.
When Dr. Meyer asks why, John shows him a brochure from a health club claiming that root canal therapy materials are toxic and should be avoided. Dr. Meyer explains that this isn't scientifically supported, but John is adamant, saying it's his tooth, he paid for the treatment, and now he wants it removed. The question then is, what should Dr. Meyer do? It's really striking how, even in a seemingly straightforward situation, ethical considerations can become quite complex, isn't it?
It really is. You've got the patient's right to make decisions about their own body on one hand, and the dentist's professional judgment and concerns about providing unnecessary treatment on the other. Big conflict.
Exactly. And the ICM presented several possible actions Dr. Meyer could take, such as suggesting he get a second opinion, trying to further educate him, refusing to extract the healthy tooth, respecting John's wishes, or having him sign a specific consent form. Then, for each of these possible actions, there were various justifications provided.
And what kind of justifications were offered in this particular scenario? Were they all based on high-minded principles?
Not entirely. Some justifications focused on the dentist's professional authority or autonomy, things like the dentist being responsible for evaluating the scientific basis of a treatment decision or not allowing the patient to dictate treatment that's not clinically indicated.
Right, the dentist's expertise.
Others emphasize patient autonomy, the patient's right to decide what happens to their body, respecting their beliefs, even when the dentist disagrees professionally. Interestingly, some justifications even considered the dentist's personal interests, like the potential loss of a patient if they didn't comply.
Oh, wow. So practical concerns, too.
Yes. And notably, in this specific case, none of the justifications directly reference the American Dental Association's Code of Ethics because the code didn't specifically address this type of situation.
That's fascinating that the professional code didn't even offer guidance in this particular ethical dilemma. So how did they determine whether some actions and justifications were actually more ethically sound than others? Did they just guess?
No, they asked a group of dental ethics teachers from across the country to evaluate the different action choices and the corresponding justifications, rating them as appropriate, neutral, or inappropriate.
Okay, expert consensus.
Exactly. They found a very high level of agreement among these experts on which actions and justifications were ethically reasonable and which were unreasonable. However, there was less consensus on what the single best action or justification was.
That makes sense. Ethical dilemmas often don't have one clear right answer, but there are definitely some approaches that are, well, less ethically defensible than others. So how do they actually score the responses on the ICM?
For each case, they calculated several scores by comparing a respondent's rankings of actions and justifications to the expert consensus. They looked at how many of the ranked items aligned with what the experts considered appropriate and how many aligned with what they considered inappropriate. This allowed them to generate scores that reflected how closely a person's ethical reasoning matched the expert consensus.
And then they use this measure to compare different groups, college freshmen, dental freshmen, and dental seniors, correct, to see if it actually measured learning.
Exactly. Their thinking was that if the ICM was a valid way to measure understanding of dental ethics, then senior dental students who had received more ethics education should score higher than dental freshmen.
Makes sense.
And dental freshmen who had shown some interest in the field should score higher than college freshmen with no specific dental focus. And that's precisely what their findings showed. Senior dental students scored significantly higher than freshmen, who in turn scored significantly higher than college freshmen. They also observed that the novice groups were more likely to misclassify items, rating good choices as bad and vice versa. So when you say significantly higher, what does that practically mean in terms of how senior students approach ethical problems compared to freshmen?
Yeah, like, are they just a little better or a lot better?
It suggests that their ethical reasoning, as measured by the ICM, is much more aligned with the thinking of experienced ethics educators. They're better at identifying appropriate actions and justifications and less likely to endorse inappropriate ones.
That seems like pretty strong evidence that the ICM is actually measuring something related to expertise in dental ethics. Did they also investigate how it related to other measures, like general moral reasoning or academic performance,
Right.
like GPA?
Yes, they did. They found that ICM scores were consistently and significantly correlated with scores on the Defining Issues Test, DIT, which is a widely used measure of general moral judgment.
Okay, so related to general moral reasoning.
Yes, but interestingly, they found no significant relationship between ICM scores and GPA, a measure of academic aptitude.
Really? Not GPA?
Nope. This suggests that the ICM is indeed measuring ethical reasoning specifically, and not just general intelligence or, how good someone is at taking tests in the dental curriculum. The fact that it correlated with the DIT but not GPA also indicates that it's capturing a unique aspect of reasoning.
That is interesting.
This suggests that the ability to reason about abstract moral dilemmas also plays a role in how well someone understands these more specific professional ethics concepts.
That's really interesting. So it seems like both general moral reasoning and this profession-specific ethical understanding, as measured by the ICM, are important. The paper also touched on how these concepts might relate to the ability to handle new, unfamiliar situations, didn't it?
Yes.
And you can imagine similar profession-specific measures could be developed in fields like engineering or journalism, right? Focusing on their unique ethical challenges and intermediate concepts.
Absolutely, yes. They included both familiar cases, similar to those discussed in their ethics curriculum, and novel, unfamiliar cases in the ICM. They found that while senior students performed better than freshmen on both types of cases, the difference was more pronounced for the familiar ones.
Okay, so education helps more with what you've seen before, which makes sense.
Right. It suggests that ethics education helps in addressing both common and new ethical challenges, but perhaps has a stronger effect on the familiar scenarios.
But they also wanted to see if that more general moral reasoning ability, measured by the DIT, played a role specifically in tackling those unfamiliar cases, right?
Yeah,
When you don't have prior specific experience.
exactly. Even after accounting for the effects of ethics education, by statistically controlling for DIT scores, they still found that seniors performed better overall. However, they also found that DIT scores independently contributed to performance on those unfamiliar cases, particularly in identifying the worst actions and the best justifications.
Ah, so that general reasoning kicks in more when it's something novel.
It seems so. It suggests that a strong foundation in broader moral reasoning principles can be really beneficial when facing new and unexpected ethical dilemmas in a profession.
So it's not just about learning the specific ethical concepts within your field. Having a well-developed sense of general moral reasoning can also help you navigate those new and unexpected ethical challenges.
That's a key takeaway. And the researchers also looked at how these intermediate concepts might link back to REST's original four-component model.
Ah, yes, bringing it all full circle. How do they connect it back?
Well, they noted that while REST's model highlights both the independence and interdependence of those four components,
Sensitivity, judgment, motivation, character.
right, Their research using the ICM showed that senior students demonstrated stronger connections between their justifications for actions, which relates to moral judgment component 2, and their actual action choices, related to moral character component 4. And this was true in both familiar and unfamiliar cases. This suggests that ethics training might actually strengthen the integration between these different aspects of moral functioning.
So as you gain more experience and education in professional ethics, your ability to not only reason ethically, but also to act in line with that reasoning becomes more integrated. The pieces connect better.
That's the implication. The findings from this research on intermediate concepts in dentistry make a really compelling argument for this way of understanding ethical reasoning, particularly in professional contexts. While they haven't established a developmental sequence for these intermediate concepts in the same way as for general moral schemas, the evidence clearly points to significant differences between experts and novices.
So to wrap up our deep dive for today, we've explored the importance of considering more than just moral judgment when we think about moral behavior, thanks to REST's four-component model. And this idea of intermediate concepts really emerges as a vital link, connecting those abstract moral principles to the specific ethical challenges that arise in different professions.
Yeah, that bridge concept is key.
Definitely. The research in dental ethics provides a concrete illustration of how we can actually assess these concepts and how moral education, combined with the development of underlying moral judgment, can really influence ethical decision-making, especially when we're confronted with new and unfamiliar situations.
Precisely. And for you, the learner, understanding these different levels of moral reasoning, from the broad principles to the profession-specific concepts and even the codes of conduct, and recognizing the various factors that influence ethical behavior, gives you a really valuable framework for analyzing ethical issues in any field you're exploring.
Right.
Recognizing how sensitivity, judgment, motivation, and character all play a role, along with the significance of those profession-specific ethical concepts, can really empower you to approach complex situations with greater clarity and, well, a deeper understanding. So in whatever field you, the learner, are focused on, there will likely be a similar set of core ethical understandings.
Absolutely. And it really prompts you to think. Considering how these specific ethical concepts within a profession are so crucial, it makes you wonder, how well defined and understood are the intermediate concepts in your particular field of interest?
Good question.
And what role does a deeper understanding of these concepts play in navigating the unique moral landscape of that field? That's definitely something to contemplate as you continue your learning journey. Thanks for joining us for this deep dive.